Hello, my name is Jennifer Sweeney and I'm an NSC 890, Synthesizing Evidence for Advanced Nursing Practice. The integrative review that I'm going to discuss examines effectiveness of health promotion, financial incentives, and smoking cessation in teenagers and adolescents. So, in adolescence, how does providing incentives for smoking cessation compared to not providing incentives or treatment as usual affect smoking habits within 6 months? The effects of smoking in adolescents. The National Academics of Sciences and Engineering and Medicine states that exposure to nicotine in teens can rewire their brains, causing them to become more dependent on other substances more easily. Toxic substances are released from e-cigarettes and cigarettes, and there are incidents reported of e-cigarettes exploding, causing injury. Beginning smoking in the teen years is likely to lead to a lifetime of nicotine dependence. It also changes the brain, and causes teenagers to become more easily addicted to other substances. It leads to a lifetime of poor health choices. The problem is significant in advanced nursing practice, especially with family nurse practitioners who are responsible for educating and creating optimal health for their clients. The purpose of the literature reviewed is to determine in adolescents how does providing incentives for smoking cessation, as opposed to or compared to not providing incentives or treatment as usual, affect smoking habits within 6 months. So, the theoretical framework that fits well with this study and this PICO question is the Larrabee quality of nursing care. The theoretical framework of Larrabee quality of nursing care applies to the question, does providing incentives for smoking cessation compared to not providing smoking incentives affect smoking habits within 6 months? The framework is based on the understanding of healthcare quality and how to produce effective healthcare quality, and it also incorporates economic impacts. So when you are dealing with health promotion, financial incentives, you have to determine how you are going to obtain the resources to provide financial incentives. So, economic impact is a really important factor when examining financial incentives. Definitely the need for financial support, in addition to the importance of understanding the intervention to determine if the benefit over time, as opposed to providing tertiary prevention later on, is worthwhile to implement into practice. So, 3 studies were reviewed. 2 quantitative studies and 1 qualitative study. A level 1 evidence or meta-analysis was reviewed. There were 182 randomized controlled trials. Children and adolescents who reported by surveys that they were smoke-free were eligible for incentives. The evidence provided supported the intervention, and it did show smaller percentage of smokers. The confidence level was 95%. The Level 2 evidence was a randomized controlled trial. Subjects were divided into 2 groups, a control group and an intervention group. The control group got treatment as usual, which was brochures and education regarding smoking cessation. The intervention group got the same treatment as well as financial incentives for smoking cessation. At the end of the 12 months, 4.8% of the participants in the control group had stopped smoking, and 18.3% in the incentive group had stopped smoking. There was also a qualitative study reviewed. The purpose of that study was to explore the views of public health policymakers on health promotion financial incentives to determine what could make HPFI, health promotion financial incentives, more acceptable. Subjects were interviewed and they were allowed time to clarify their views. The majority of participants believed that financial incentives were more effective than care as usual, and most elaborated that it was more acceptable to use and implement than penalties. To optimizing nursing practice. The evidence in the studies is valuable to a leader of healthcare or advanced practice nurse when implementing interventions into practice. The randomized controlled trial and meta-analysis provided strong evidence and facts based on quantitative evidence. There were actually numbers and percentages. The qualitative study was really important, especially for advanced practice nurses who plan to exercise their emancipatory nursing and lobby and legislation to try and get support for health promotion and financial incentives. So, one intervention suggested is advanced practice nurses who treat adolescents establish programs that provide financial incentives for biochemical verification of smoking abstinence. Advanced practice nurses could use the evidence from the research to get buy-ins and financial support from tobacco campaigns and or health insurance companies. Currently, a lot of health insurance companies penalize their clients for smoking. They have higher rates due to the increased likelihood of disease and illnesses related to smoking and in direct relationship with cost. Instead of penalizing smokers later in life, financial support could be more likely to be provided by health insurance companies to promote healthier lifestyles earlier in life as opposed to paying for tertiary interventions later on. In the healthcare environment, advanced practice nurses who choose to implement the intervention of health promotion financial incentives would ideally provide the intervention in an outpatient setting to teens and adolescents as primary care. To manage the interventions effectively, the nurse practitioner would have to supervise the program to ensure proper education has been provided, as well as evidence such as biochemical verification. The insurance company would likely need that to continue supporting